Thousands of Nevadans are now diagnosed with the coronavirus daily. Doctors say the vast majority recover, but what's not known is how many people have lingering side effects. Scientists across the globe are chasing that figure, but estimate it's 10%. Two people in the valley explain how after they recovered from COVID-19, their health battle has been frightening.
There was nothing wrong with my heart. It would soar to 141 laying down to go to sleep. Then there's the hair loss, which stopped. My teeth were feeling loose.
Chris Ruggiero's lingering symptoms are bizarre and scary. She contracted the coronavirus in March and was hospitalized, but not intubated. What's unknown about COVID-19 is how many people and Nevadans are living with lasting side effects. A UK study published in the Journal of the American Medical Association found 10% of patients may suffer for months after the virus goes away. These patients are called long haulers.
I have gone to 3 different primary care doctors. I think a lot of us are just flailing at whatever we can get. Who heard of a good pulmonologist whose doctor listens to them.
She joins thousands of Americans searching for doctors or now seeing multiple specialists at once. A survey from the Indiana University School of Medicine looking at the Facebook group Survivor Corps found common symptoms include fatigue, shortness of breath, insomnia, headaches, difficulty focusing, chest pain, heart palpitations.
To be fair to the doctors, it's kind of hard to know where to go.
I actually got very sick in April, 8 months. I'm so done with this thing. I want it to be gone and done with. Fatigue is like 100 times worse than any fatigue I've ever felt. My lungs had a little bit of the COVID streaking across one lobe.
Lolita Berrien, who's a second-grade teacher at CCSD, has been seeing a neurologist, is set to see an endocrinologist, and now has neuropathy. She fears what could happen if she contracts the virus again.
It's got to all hang in there together because the doctors don't know what to do. They're at a loss.
I can understand why people say, oh, it's not a big deal. Not a big deal at all. My nephew survived it after a couple of days of being sick. They're the fortunate ones.
Across the country, from UCLA to Mount Sinai in New York, major institutions are starting research centers, all to help these long haulers. UNLV School of Medicine says there's preliminary talks to start one right here in the Valley.